you want to call to order, Mr. Mayor, I will let you know when she arrives.
Good evening. It is 5:30 p.m. on August 19, 2020. This is the regular City Council meeting for the City of Sandpoint. I'm Mayor Shelby Ronstadt presiding, and we'll now do the roll call. For the record, council members Deb Rule, Joel Espiro, John Darling, Kate McAllister, and Andy Grote are present. Councilwoman Deb Rule is participating remotely, and we anticipate Councilwoman Shannon Williamson will be joining us soon as well. We'll now rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, we'll now start with announcements. Does staff have any announcements?
No, Mr. Mayor, we don't have any announcements tonight other than our arts and culture and historic preservation survey is live. You can access it both on our website as well as on our Facebook page. It closes at the end of this month, and we're hoping to get a lot of them.
Great.
Please fill out our survey.
Thanks for that.
Mr. Mayor, Councilwoman Williamson has joined the meeting.
Okay, we now have Councilwoman Williamson with us. Does council have any announcements? None from council, okay. I invited the Panhandle Health District to come here and give us our regular COVID-19 update. With us today, we have Dawn Duffy. You're here? You, Dawn? Great. Christina Gavin and Catherine Colbert. I invite you to please come forward to the podium, and they are going to give us an update on kind of where we're at generally with COVID in Bonner County right now. And thank you all for coming. We really appreciate your presence here this evening.
Well, thank you, Mayor, for the opportunity that we have to come to present to you today from Panhandle Health District. My official title at Panhandle is the Health Services Administrator. So I oversee a lot of our health services, including WIC, clinical services, health promotion, epidemiology, home visiting, and home health, among others. But right now, in addition to those roles, I'm serving as the incident commander for the COVID-19 response, the public health response for the 5 northern counties of Idaho. And with me today, I'm very grateful that Christina Gavin was able to join us. She is our nurse manager over all of PhD clinical services. And also Catherine Colbert, who is our liaison for COVID-19 response for Bonner and Boundary counties. Very grateful to be with them. I also want to say one quick word. I also meet weekly with the Incident Command of Bonner General Hospital. And I want to publicly applaud them for a tremendous effort that they have put forth in not only treatment of this pandemic, but also the great work they're doing in prevention. A lot of the hospitals in Idaho could learn from the great work that they're doing. And I appreciate the chance to meet with them. So, Mayor, I'll give you some statistics, and then I suspect that there will be questions from you, and I would be happy to do my best to answer those. So currently, Panhandle Health District, I should say as of 4 o'clock yesterday, we've received 2,478 positive COVID-19 cases that we are working. Bonner County to date, as of yesterday, have received 192 positive cases. Just for reference, in the state of Idaho, there has been a total of 28,326 positive COVID-19 cases. We also look at an interesting statistics, and notice the cases that are active, that we're continually monitoring and responding to. And Panhandle Health District, so again, for the 5 northern counties, we're actively following 592 cases. In Bonner County, we're continue to manage 29 cases. We have had to date 143 hospital admissions due to COVID-19. Best record that we can tell is only 11 of those have come from Bonner County. Not all of those cases, in fact, only a few of those are treated here locally. Most are sent to Kootenai Health due to their acute care nature. Currently in the hospital, there's 22 that are admitted. 7 of those are in critical care. Deaths throughout Panhandle Health District, there have been 28 deaths associated with COVID-19. There have been 0 deaths that have come from Bonner County. In the state of Idaho as a whole, there's been 282 deaths associated with COVID-19. Other statistics we follow is healthcare workers. In the 5 northern counties of Idaho, there have been 154 healthcare workers that have been infected by COVID-19. In Bonner County, there have been 420 individuals, healthcare workers. In the 7-day, one of the interesting statistics we follow is cases per 100,000, only 8 healthcare workers here in Bonner County have been affected by COVID-19. Another statistic we look at is cases per 100,000 population. So we try to level the playing field throughout the counties. In PhD as a whole, throughout the 5 counties, there's been 1,192 cases per 100,000. Interestingly, in Bonner County, it's only 420 per 100,000. That difference is even clear when we look at just the 7-day average per 100,000. In Panhandle Health District, it's 17.8, and that is just over a 7-day period, 17.8. In Bonner County, it's only 4.1. Another statistic we follow that we can only give you for the entire Panhandle Health District is the positivity rate. Of those that are tested, how many come back positive? Currently, that number is 10.49% of those that are tested come back positive. Nationally, that rate is 6.5%, and in the state of Idaho, that is 12.3%. So those are the statistics that I have for you today. Mayor, you had provided me some questions to go over. I can either go over those now, or if you have specific questions, I would be happy to entertain those. How would you like me to proceed?
Yeah, let's intervene for a moment. And if council has any questions to this point as far as what was provided already, then I invite you to please continue with the questions. Thank you.
Okay, you bet, Mayor. Thank you. One of the questions was, what are the best practices for reducing community spread? Let's define community spread. Community spread simply means we don't know where that case came from. Early on in our investigations with these cases, we were often able to go back to travel. We could talk to folks who were positive, and through our epidemiologists, we were able to, most of the time, find out where those cases came from. Currently, every county has community spread, meaning we don't know where that case came from in all of the investigations that we have, and that's an important distinction. So the question is, how do we prevent that? And you've probably heard of all of these steps. Is self-isolate when you are sick. Sounds simple, but sometimes hard to do. Frequent hand washing. Social distancing 6 feet to avoid, and this is important, close proximity for more than 10 to 15 minutes. Keep surfaces clean and wear a mask. Also do rapid testing if you feel that you are symptomatic. Another way to reduce community spread, the best we can, is to do contact tracing or case investigation. Feel free to jump in here anytime. The big question I know that we have is wearing a mask in public when social distancing cannot be practiced helpful in reducing community spread. Is it effective in reducing the risk of acquiring COVID-19? And I'm going to read you some information here and let you be the judge. In an editorial published today in the Journal of American Medical Association, JAMA, CDC reviewed the latest science and affirms that cloth face coverings are a critical tool to fight against COVID-19. They could reduce the spread of the disease, particularly when used universally within communities. There is increasing evidence that a cloth face coverings help prevent people who have COVID-19 from community spread to the virus. I have done an immense amount of reading regarding this question itself. And one of the best articles that I found was produced from Brigham Young University when 4 professors in environmental science, genetics, and genomics and biotechnology, they reviewed 115 scientific studies related to COVID-19. And they came up with 5 conclusions, and if I may just read those to you. In the first few months of the pandemic, there was significant uncertainty about the usefulness of public masking. Conflicting guidance was given by several official sources. We've all heard that. There is now convincing evidence from multiple controlled experiments and field observations that wearing masks reduces the transmission of COVID-19 for healthcare workers and the public. Most of this evidence is COVID-19 specific and has emerged just in the past few months. 3, masks prevent infected people from spreading the virus to others by trapping the respiratory droplets, tiny moisture particles, that are produced when we cough, speak, and breathe. Cloth masks can stop 90% or more of the dispersal of droplets carrying the virus. There is some evidence that cloth masks also protect the wearer from infection, though this is less certain. We see that being confused frequently, that the reason you wear a mask is to prevent others from contracting the disease. There still isn't a lot of data out there that it prevents you from getting the disease. 4, masks are highly safe, with only minor and uncommon side effects. In addition to medical studies, public masking has been proven safe among children, adults, and the elderly in cultures where this practice has long been common. However, some individuals should not wear masks, such as those with severely compromised respiratory systems and individuals who cannot remove or adjust their own mask, children under 2, and people with severe disabilities. And the last point they make is researchers from hospitals, universities, the private sector, and government agencies has concluded that masks could be one of the most powerful and cost-effective tools to stop COVID-19 and accelerate the economic recovery. There is universal agreement, however, that masking alone will not be enough to stop the pandemic. Masking is most effective when combined with physical distancing, frequent hand washing, rapid testing, and coordinated contact tracing. Now, I gave you a whole lot of information to ponder. If anyone would like reference to this study, I would be happy to provide it. But ultimately, and let me be very clear with this, masking is only going to work if there is compliance. And I want to emphasize that. I know that sounds like a simple statement, but compliance is the key to make that happen in a community. Any questions thus far?
No.
Okay, thank you. Let's see, what factors is PhD considering when determining whether a mask mandate is appropriate? And this kind of ties into another question of why was that choice made in only Kootenai County? Earlier, I shared with you some statistics that really heightened this for Kootenai County. As you remember, I shared with you the case count in Kootenai County was 1,192 per 100,000. In Bonner County, it's less than half of that, 420. So that was one reason, certainly, that we made that the Board of Health, I did not make that decision, just for clarity, that was the Board of Health that made that decision, but that was an important factor in their consideration. We also were seeing a rise in admissions at Kootenai Health, and that was another reason that decision was made. Let's see. Do you anticipate a change in the directive coming from PhD, Panhandle Health District, in the future, and what might that be? I don't know of any change at this time that the Board of Health is considering. I do know that we have created a response plan, which we can put levels of transmission in 2 categories: mild, moderate, and severe. And we are in the moderate category. We know if we were to go into the severe category, so if cases were to increase dramatically, we don't have any specific guidelines if that happens, other than we will speak to our community partners, and that could definitely be all of you in this room, if another step would happen regarding a further step with Panhandle Health District. But let me say again, I don't know of any change in plans at this point. A really good question that the mayor posed to me was, how successful has the mask mandate been in Kootenai County? That is a really good question, and frankly, it's too early to tell. And again, I go back to, it depends upon compliance. I can give you reference to the state of Utah, where Salt Lake City County, they're right in the city itself, obviously, they did implement a mask mandate in June. The other counties in the state, or at least around that surrounding area, did not. Salt Lake County has seen a decrease in cases, where the counties outside have seen an increase in cases. I'm sorry, I don't have greater information. Give me a month and I'll have more information for you on that as it relates to Kootenai County. Another great question, Mayor. Can you speak to the success of its implementation and enforcement? Goodness, that's been an interesting one. We have had a number of people protesting this mandate, and I've had the privilege of getting to know them about what some of their concerns are. Tuesday, I spent over an hour with them and had lunch with them, and we talked a lot about their feelings. It certainly goes both ways on this. There are those that are very, very loud about not having a mandate. There's those that are very loud about enforcement of the mandate. I think there have been some benefits from it we've seen. Certainly we've had multiple businesses, long-term care facilities, we've had churches and other organizations that have come to us saying, thank you for the mandate, because it gives us an opportunity then, that is the door for us to go through, to invite our patrons, to ask them to please wear a mask when you come into our facility. This came from Panhandle Health District, so we're just going to enforce this as you come into our facility. So in that sense, it's been a great success, where they've had the opportunity to protect their businesses by asking their patrons to wear a mask. Once again, time will tell to see how that affects our community. Another question. It seems that within Bonner County, the number of daily cases peaked a couple of weeks ago at 82 and now is hovering in the 50s or 60s. Are we flattening the curve? Just to again update you on the statistics, Bonner County has had 192 cases compared to Kootenai at 1,978. Currently, there's around 30 that we're actively monitoring. So the question of really flattening the curve, we have seen some positive. We're very, very cautiously optimistic of what we're seeing in our cases. A couple of weeks ago, or even beginning of last week, we were regularly getting cases of upwards to 70 to 90. We had a couple of days of 100 cases a day. Over the last week, we've seen a significant reduction in cases now to closer to 20, 30. 2 days ago, we had 12 cases that came to us. We checked out our sources, our labs, to make sure we're getting them in a timely fashion. It appears that we are. So we're cautiously optimistic with that. We're also beginning to see a slight drop in our positivity rate of cases that are coming in. We're also seeing less people. There's been a slight drop in the number of people coming in to be tested. So there is some good news out there, but probably a little early to tell whether or not we're flattening the curve. One might ask why Bonner County has such a low rate per 100,000. First of all, I think the county's done a good job, possibly with Bonner, I think with Bonner General leading the charge on helping to prevent this disease. You also have the great benefit of being more rural. You simply don't bump shoulders together as often. And I believe that's probably the leading reason why your cases aren't what we're seeing in Kootenai County. Question 9, I believe, Mayor, this is your last question. No, there's one more after this. We've had 189 cases as of Thursday, yet only 2 hospitalizations and no deaths. The number of hospitalizations, less than 2% of total cases, seems significantly lower than in other communities. It is, you've actually had 11 folks from Bonner County, and many of those are being seen at Kootenai Health. But still, you're absolutely right, Mayor. That's a very low number. And what a marvelous blessing it is that you've had no deaths from Bonner County. We sincerely hope that that number continues. And finally,
And just to clarify that, so again, you would likely attribute that to just to a rural nature.
I think that's the lead reason, and I think there's a lot of good work happening in this community to prevent disease, yes. And finally, do you have any suggestions for the council as to steps we can take as a community to reduce community spread COVID-19 and improve public health and safety as it relates to the novel coronavirus? I believe most of these things I have talked about, and I'll just mention those again. Is self-isolate when you're sick. How critical that is. You know, we have school districts that as you know, that give kids bikes away if they don't ever miss school. Now that's a great thing. I've had kids that have enjoyed that, but kids are coming to school sick so they can get their bike. Some of those changes need to happen. I don't mean to just isolate schools, but when people are sick, they need to stay home. Kids, adults, anyone, they just simply need to stay home. Even if it's just a sniffle, they need to stay home. I hope that all organizations are increasing their abilities to work from home. Frequent hand washing cannot be overemphasized. Social distancing is clear. And remember that 6 feet that we've heard so much about. It's within that circle for 10 to 15 minutes that's the key. Yes, you could brush by someone and potentially catch one of those droplets. It's still an opportunity. Remember, the entry points for those droplets are nose, mouth, and eyes. So there is an opportunity for that to get in. But certainly, if you're within that circle of 10 to 15 minutes, that is going to increase your risk.
Don, correct me if I'm wrong, but isn't it about it's the viral load that's important? If you have to get a large enough of a dose in order to likely contract the illness, or?
Well, certainly I would say that's part of it, Mayor, but it doesn't take much to get sick. Viral load is really important when it talks about when you're going to get tested. So for example, let's say you had contact, you were within that 10 to 15 minutes with someone who was COVID-19 on a Saturday, and you call your doctor and say, hey, I want to go get tested today because I was by someone. It takes 5 to 8 days to have sufficient viral load in your system to even test that you have COVID-19. So if you've been by someone who's positive, isolate yourself for 5 to 8 days and then go get tested. Otherwise, it'll probably, if you go the same day, there's a chance it's going to be negative. And the false negative rate drops as you move closer toward that 5 to 8 days. But still, even at 5 to 8 days, there's a 30% negativity rate on these tests. Again, we've talked about wearing masks so much, we're all sick of hearing it, but it's also wearing masks properly. We talked about the entry points for the disease and how we can expel that, and I think we know about that. One thing that Bonner has done a great job is they test very quickly and they get results back very quickly. That's been a great benefit. And then the work that we do, and also the hospital does, is the contact tracing. Finding out who is positive, and there's been a lot of controversy about that. And let me just walk you through real briefly what that process looks like. So Panhandle Health District will receive a report back from a lab. We will look at that report and identify that there was a positive analysis from that lab report. We immediately call the person who is on that report and ask and just make sure that their symptoms are good, make sure they're doing okay. I've done that myself. A couple of weeks ago, I did a contact trace on a woman in her 20s. She thought she was okay, and then when I asked further, she had chest pain. She couldn't lay on her side without pain. Cough. She really wasn't doing well, and we immediately got her over to the hospital. So we certainly are analyzing their symptoms. We are also talking to them about quarantine and how that works, when they can go back to work, trying to answer all the questions they have. And part of that discussion is we ask them, who or what groups have you been in contact with 2 days prior to the onset of their symptoms. So we go back a little bit. And if they are willing, and only if they are willing, they will give us names and phone numbers. We don't investigate ourselves to try to find them, only if they are willing to give those to us. We then call them, what we call the first circle of contacts, and we will speak with them, talking about the same thing, signs and symptoms, how they quarantine and how that works. We give them all a toll-free number that they can call us if they have any questions. And then it's just part of a medical record, and that's the end of that. Other than we are monitoring them and calling them regularly throughout their time of potential sickness. And finally, I would just say, and how we can reduce community spread, it's so much is about education. I met with a group last night in Kootenai, which included physicians who were still unclear on some very simple things as it relates to COVID-19. Most are certainly well-versed in it, but I was surprised. And I think education is very important. So I've probably taken too much time, Mayor. There you go.
This is great.
Anything else I can help you with?
Well, first, let me ask, I have a couple questions. So you mentioned the action plan that the board developed. When they had their meeting a few weeks ago, at which time they mandated masks in Kootenai County, did they establish a standard or threshold by which they would mandate masks in other counties? Was it a certain number? Was it a certain number of hospitalizations, relative to capacity? What was that threshold that was met, and where are we at in relationship to that threshold?
Good question. So honestly, when that decision was made, it was just basically on the significant rise in cases that we had in Kootenai County, and it was based on the hospital admission rates. And we were looking at other counties and comparing us to them and finding, unfortunately, we were on top in terms of where we were with those cases. So that decision was made. We have subsequently put those gradients in place of where we are in terms of our case mix. So what we look at, and I mentioned this a moment ago, is the number of cases per 100,000 on a 7-day average. So we don't need to measure the past. Let's measure where we are today on this. And to get into what we call the orange category, which is right below red, that's at around 25 cases. Kootenai County is at 7.8, and as I recall, your number is as low as 4.1. So you would be considered currently in what we would call the mild category for cases, if that's the only factor that we looked at. We don't look so much at hospital cases here in Bonner County because most of those acute cases are, in fact, the vast majority are sent down to Kootenai Health. You should still consider that because we don't want all the beds being filled in Kootenai because you will be sending cases down there, and we need to monitor that very closely. So we do have a gauge in place, and right now you're below that orange category. I think it's yellow, I think is where you are right now. And there's a green that's below that.
And what was that 7-day average when that mandate was issued in Kootenai County, do you recall?
I believe that was closer to 30 at that time, but that's a bit of a guess on my part, Mayor.
And how many beds do you have at Kootenai Health Center?
Well, overall beds, there are over 200 beds, but I believe in their COVID wing, there's around 26 to 30. Christine, I don't know if you...
26.
It's 26 at Kootenai Health. Thanks, Catherine.
Okay. And is that, and at the time the mandate was issued, were those full at that point? Or?
No, they were not. They were actually much less than what they are right now.
Really?
Mm-hmm.
And so what's the occupancy there now?
They're at 22, and 7 of those 22 are in critical care.
And currently I believe we have 3 ICU beds at Bonner General, is that right? And I understand that none of those
We have talked about that, but I
They
don't.
have the ability, I believe, to do up to 7, 6 or 7, with some adapting on their part.
Okay.
But right now, they would be sending them to Kootenai Health for the most part if they need COVID care.
Okay.
But they have the capacity for 6.
Okay, so even though we have available respirators here, there's more
My understanding, and I don't want to speak for Bonner General super specifically, but my understanding is they may not have the ability to, some of the things like remdesivir or some therapeutics, high flow oxygen, things like that, that Kootenai Health has access to. So while they may be able to care for them, I'm not sure they have all of the things that Kootenai Health would have.
Okay, thank you. Does council have any questions? No?
I guess I have one, Mr. Mayor.
They're in critical care.
Is there any other underlying health issues that these individuals have that you're aware of?
Well, I don't know about the cases that are in there right now. We aren't, due to HIPAA, we aren't given that information. I can tell you that of many of the deaths that we've had, and though they've ranged from the 60s to the 90s that we have seen, often there are underlying health conditions with them, if not the vast majority of the time.
The 20-year-old, was there any other underlying health issues she shared, or?
I did ask her that question. She did not know of any.
Okay, thank you very much.
You bet.
Deb, Councilwoman Wood?
I just wanted to point out that as far as the beds down at Kootenai, they run almost at capacity on a normal basis, and we're doing so in their critical care units before the COVID outbreak happened. So it's not always a matter of the beds, but it's a matter of the staff to provide care for those beds. And that's sometimes where you start to run up against a problem, because you can open as many beds as you want, but if you don't have the staff to care for the patients, you get into trouble. And then I would like to point out to Councilman Aspero that as far as underlying health conditions, being overweight is considered an underlying health condition for COVID.
Absolutely.
Thank you, Councilwoman. Yep.
I don't have any questions, but I really appreciate you specifically taking the time to articulate and answer. Mayor, those were great questions. That was incredibly informative, something that I think all of us have needed for a long time. So if we could, as we move forward, invite you back to have to address us in the specific articulate way that you did. So thank you very much.
And I would be happy to do
Thank
that.
you.
Thank you, Council.
Anyone else? Again, thank you, Dawn, Christina, and Catherine. Really appreciate you coming here today. That was a great presentation. It was really informative. And we will expect to see them back in the future.
Thank you.
All right.
Or hopefully not.
We'll now proceed with the public forum portion of the meeting, which gives the public the opportunity to address the council regarding items that are either listed on the consent calendar or not on the agenda. To accommodate those who wish to speak on general items during the public forum, as well as those who wish to speak on specific business items on our agenda, a total of 20 minutes will be dedicated to public forum at the beginning of the meeting now. If you would like to speak and did not have an opportunity to do so, we'll give everyone an opportunity to speak by reopening the public forum at the end of our regular agenda. Those participating in this meeting will refrain from disruptive behavior, such as loud noises, clapping, shouting, or engaging in any other activity in a manner that disturbs, disrupts, or impedes the orderly conduct of this meeting. Public participation is and will remain at my discretion. Comments shall not be personally derogatory, nor shall they be personally directed at any individual, organization, or business. Do not direct any questions to the mayor, city council, or staff during your comments. Each speaker will be allowed 3 minutes. In the interest of time, please do not repeat prior comments, but simply state your support of those comments. We will now be taking comments from city Sandpoint residents first, both those participating here in chambers and those attending by Zoom. Then we'll hear from those who do not reside within our city limits. Clerk?
Thank you, Mr. Mayor. As a reminder, public forum is limited to comments regarding items listed on the consent calendar or on any topic not listed on the agenda this evening. Our first speaker will be Kevin Kulinder. Kevin, I'll need to unmute you, so give me one moment.
Kevin, are you with us? Kevin?
Kevin, you'll need to go ahead and indicate on your phone or on your computer that you wish to be unmuted.
Okay, well, perhaps we can come back to him.
Okay.
Melissa?
And here in chambers, we have Kay Jorson. She may
Ms.
be
Jorson,
outside.
are you here? Is Corey?
Is she outside perhaps?
Kay Jorson.
Kay Jorson.
Can you call another and then we can cue her?
Certainly. We're going to try Kevin again. Kevin Kulinder.
Ms. Jorson, thank you for joining us. You have 3 minutes and please state what apparently you do reside within the city.
I'm in the county, in Kay Dorson for the record. All right, I want to talk about the human sex trafficking problem we have in our area. If you're not aware of this going on in our country or even in our community, people are living under a rock. We have recently heard of many reports of men luring children to go with them at a lot of beaches in our area. Imagine for a minute losing a child you love or someone you care about in this world we are living in today, where you can't see anyone's identity. What this tells our community is that people do not care about our community and the safety of our children. I would like to show you this image of a child and how fast their identity can change in 3 minutes. This little girl went from a little girl in a black shirt and pink shorts to a little boy looking like a little boy with a baseball cap, hair up, tape over face, and face covered. Thank you.
Thank you for those comments. Clear?
We're going to go back to Zoom.
Okay. If we can, is it possible to have the captain queue up some people here?
We want to
And then-
grab these folks.
Captain.
Jordan Emmert.
Jordan, are you there? Mr. Emmer?
Okay. And I'm going to call John Hankel on Zoom. It's not clear whether he wants to speak, but,
Okay.
and he actually is not in attendance, it appears. So here in Chambers, Mr. Grafton.
Mr. Grafton, are you here? All right.
Ted,
You
yeah.
got one. Thanks, Ted, for being here.
Hey, before I start my 3 minutes, may I show you what encouraged me to talk tonight?
This will be included in the 3 minutes, sir, but yes, you can show it.
If you, it's a picture of Pearl Harbor.
You start the clock, please.
And hopefully you can hear me. My name is Ted Grafton, Sandpoint. December 7th, 1941, Pearl Harbor, least we forget. September 11th, 2001, 9/11, Twin Towers, we will never forget. With the burning of the American flag, dishonoring the national anthem, tearing down historical statues some have forgotten. Socialism, Marxism, communism are enemies of America and our Constitution of the United States. Stand for America or fall with New World Order, the new norm. America will never be destroyed from the outside. If we falter and lose our freedom, it will be because we destroy ourselves. Good, evil, right, wrong, lawfulness, lawlessness. The freedom of speech and the freedom of peaceful assembly has turned into rioting, looting, destruction, fear, and power. It's Marxism in the form of Antifa and Black Lives Matter movement versus our very capable and very underappreciated law enforcement professionals, the vast majority of whom are fighting to provide us safe and secure homes, streets, and communities. When you line up with evil, you become bound by its destruction. Blessed is the man who walks not in the counsel of the wicked, nor stand in the way of sinners, nor sit in the seat of scoffers. But his delight is in the law of the Lord, and on his law he meditates day and night. He is like a tree planted by streams of water that yields its fruit in its season, and its leaves do not wither. In all that he does, he prospers. The wicked are not so, but are like chaff that the wind blows, drives away. Therefore, the wicked will not stand in the judgment, nor sinners in the congregation of the righteous. For the Lord knows the way of the righteous, but the way of the wicked will perish. And I was inspired by that picture of Pearl Harbor and how our American troops gave their lives and suffered their loss, and then we don't stand behind it.
Mr. Grafton, your time is up, and we thank you for your time.
All right, I wish I had 3 more minutes. Thank you.
Thank you for your comments, sir.
Judy Jury.
Hi, I've been in Sandpoint 3 years. I came from Oregon. I have 42 years of working in corporate America with a lot of big corporations. I rolled out emergency management and business continuity programs. And when I started, it was a few years before the bombing in Oklahoma City. And nobody listened to me. Nobody wanted to talk about it. Nobody wanted to think that something could happen in their community. Then we had the bombing in Oklahoma City. I went from there to working for big companies like Nike and HP and a lot of big names. One of the things I learned along the way was, even though I want something really bad, other people may not want that. And so I learned to get my words across. I learned how to listen to other people and compromise and try to meet in the middle. You might not always get what you want. Maybe you'll get halfway. And that's how I rolled my programs out. And after a while, they learned to trust me. They learned that I would be there for them if they had a disaster. And I encourage you from the bottom of my soul to think very heartily about how you approach the citizens of Sandpoint in the same way that I did. You probably have something in your mind you really want. Maybe you won't get it. But maybe, and the people have to learn to do the same thing. Maybe they won't get what they want. But in the long run, who are we for? Each other. And success and accomplishments. And I just encourage you if you could listen to me, I have that knowledge. I had that experience. I know what it is to go against people that don't show up for meetings, that don't want to listen to me, that don't want to do what I want them to do, to be safe. That's what my programs were, is to be safe. And I know you want us to be safe. So I just encourage you to use your heart as well as your evidence and listen to your people and try to compromise once in a while, even though you might want it your way. That's my words.
Thank you, Ms. Drew. We appreciate those comments. Very good comments.
Mr. Mayor, I'm going to go back to Zoom here
Okay.
and try individual. Mike Stokowski.
Mr. Sikowski, are you there?
I have no one else signed up for public forum, Mr. Mayor.
Are we waiting for anyone?
I'm going to
Outside.
check one other Zoom attendee with the hand up indicates wanting to speak during public forum, so we'll check that.
Okay.
Janice Gore.
Yes, my name is Janice Gore, and I live outside of Sandpoint. Can you hear me?
Yes, we can, ma'am.
Yep.
Okay, I would like to point out two things. I would like to point out that apparently there are people in Sandpoint who have appointed themselves to harass and intimidate people who don't wear a mask. I've read far too many letters of.
Ms. Gore, this is Andy Doman, I'm the city attorney. The council is not entertaining comments in the public forum on the mask agenda, on the mask item that's on the agenda.
Is there something else that you'd like to comment about, Ms. Gore? Okay, thank you for calling in. Is there anyone else, clerk?
No, Mr. Mayor.
Okay. That concludes the public forum portion of our meeting. Next on the agenda is the consent calendar. For the record, the total amount of bills is $1,443,210.50, reflecting $770,909.33 for regular payables and $672,301.17 for payroll. Are there any items council wishes to remove from the consent calendar? Seeing none, I would entertain a motion that the consent calendar be approved.
So moved.
Second. It's been moved and seconded. Is there any discussion? This will be a roll call vote.
Councilman Espero,
Yes.
Councilman Darling,
Yes.
Councilwoman Williamson. Councilwoman Williamson is currently absent.
Yes, I'm having trouble with Zoom. I'm sorry. But can you hear me?
We can.
Yes?
Yes.
Yes. I think that's a yes.
Okay. Councilwoman McAllister,
Yes.
Councilwoman Rule,
Yes.
Councilman Grote,
Yes.
And the consent calendar is approved. The next item on the agenda is a public hearing on the fiscal year 2021 budget and intent to reserve the right to recover the foregone increase in the subsequent year. On July 15, 2020, Council adopted the preliminary budget, declared its intent to reserve the right to recover the foregone increase in the subsequent year, and pursuant to Idaho Code 50-1002, scheduled a public hearing with notice published twice in the Bonner County Daily Bee. City Administrator Jennifer Stapleton will now provide a presentation and information regarding this year's budget.
Thank you, Mr. Mayor. We have held two budget hearings before tonight's public hearing, and in addition to that, we have had our overall budget available, our electronic budget book available for a month on our city website, and it continues to remain available to the public and will be throughout the year moving forward. In summary, and as we have discussed in our previous workshops, Our overall proposed budget for fiscal year 21 is $34,601,714. This is a reduction of approximately 4.7 million from our fiscal year 20 budget and a decrease of just under 10 million from our fiscal year 19 budget as presented and adopted by council. The reduction that we've seen in this year's budget relative to the prior couple of years' budget primarily is due to capital construction projects really related to our downtown revitalization projects. So we carried over budget in those 2 years as we were moving from phase 1 construction into phase 2 construction and completing that. And as reflected in fiscal year budget 21, we are on a break this year from downtown revitalization. As we have previously discussed in our workshops, this budget anticipates maximizing our reserve accounts. Our anticipated emergency reserve will be just over 1.2 million, which is 12% of our fiscal year 20 operating budget, which is the maximum that is called for in our adopted policy by council. Our operating stabilization reserve, we've increased funding to that, and that too is just under $2.9 million, and that represents 28% of our fiscal year 20 budget, and again is at maximum funding. And finally, we are continuing to carry over $3 million in construction reserves. This is related to our downtown construction projects because the city has fronted the costs of constructions for those budgets and we're getting reimbursed through SURA. So we will anticipate have discussions in fiscal year 21 and going into the fiscal year 22 budget. We'll be analyzing that and looking as dollars or increments are coming into SURA, whether we can release some of that reserve to fund future capital projects. Our budget as presented includes funding for 92.75 FTE city employees, which is an increase of just under 2 employees from this year's budget. Council will recall that approximately a month ago, you approved to be a resolution moving forward with a notice of intent to participate in Governor Little's public safety and first responder initiative. The purpose of this program, as funded by CARES Act, was to reduce property taxes for residents across the state due to COVID-19 impacts. Any cities or county governments that chose to participate in this program first had to agree to forego their allowed 3% property tax levy increase, and in addition, forego any foregone funds that might be available to that local government in fiscal year 2021. As a reminder for the city of Sandpoint, the 3% allowable cap in property tax levy for the city of Sandpoint is $134,593. The available foregone that could be budgeted in fiscal year 21 is $40,754. The budget as prepared and presented to council anticipated that we would not increase the property tax levy by the 3% and we would not include foregone. Council did approve again via resolution submission of the city of Sandpoint's notice of intent to participate in that program. Last Friday, on July 24th, we actually received our pro rata allocation from the governor's office for the tax relief program. The pro rata allocation for the city of Sandpoint is just under $1.1 million. It's $1,096,260. This is based on, I updated it on yours and not mine. This is based on our public safety payroll for the period of March to December of this year. So when we submitted our notice of intent to participate in this program, we had to submit our actual and projected public safety payroll expenses for March through December of this year. For the city of Sandpoint, that totals just under $2.6 million. The governor's office made an allocation to that program, and based on payrolls that were submitted by jurisdictions across the state, they then determined a percentage of total program allocation for that particular jurisdiction. For us, it's 0.58% of the governor's total allocation for the program. So that's where we got the pro rata allocation of just under $1.1 million. This pro rata allocation is reduced overall by 3% for allowed administrative expenses for managing participation submission of this program of $32,888. It also includes an estimated reduction of the amount of tax increment that would go to SURA and would be a foregone tax increment as a result of the city of Sandpoint's participation in that program. So that amount is estimated at $137,245. That's just an estimate at this point. We received that estimate this week, and they notified us that they are verifying what that increment would be to SURA. So in essence, for local governments who choose to participate in this program, there is an offset in here to ensure that because the local government decided to participate, that doesn't have unintended consequences for the urban renewal agencies and any projects that would be funded with planned increment through urban renewal. As a result of the two reductions and the allocation, the projected estimated property tax relief for City of Sandpoint property taxpayers is $926,127. So it's significantly more than what we had been talking about a month ago when we were talking about foregoing the 3%, and we were talking about the foregone. And again, both of those things are anticipated in this budget. In the budget workbook that is available online, we had included, as we include every year, this property tax summary. But the property tax summary that is included in the book currently, and which council would have reviewed and the public has seen, was based on the 3%, not including the 3%, and foregoing the foregone. What it didn't include is this allocation because we didn't know what that allocation would be at the time. So what we're putting up here for council and the public to see is what the impact to Sandpoint City property taxpayers is by participating in this program. But again, it's using the estimated numbers that we have from the state at this point while they're verifying the urban renewal amounts. So if you look at our property tax calculations for 2020, our actual versus proposed, you can actually see what we are projecting is an overall reduction in the property tax bill of, again, with these estimates, $91.85 per $100,000 value of property. Because of these changes and because we don't have this finalized, not only are we waiting for the final changes for the allocation to firm up what that is, but in addition to that, it means that there are changes that are coming through to our L2 form. So that's our declaration of our budget and our property tax, what we're going to be taking in property tax. And it this year has been amended to include this property tax relief amount. And they're still making some changes to that form and have indicated that they will have the revised form out to local governments sometime probably late next week, in addition to the final allocation amount. So our staff recommendation to budget to the city council tonight for this budget hearing and for action is to approve the 2021 budget as presented, but we are recommending tabling tabling both our two ordinances. Why am I not? Resolutions, sorry. Thank you, Mayor. Tabling our two resolutions tonight, specifically on our foregone, as well as our appropriations ordinances. That applies again to the property tax. But we are asking council in this budget hearing to approve the fiscal year 21 budget as presented.
And Jennifer, you were half right. One's an ordinance, one's a resolution, so.
I knew ordinance was in there.
Okay, so any questions?
Mr. Mayor, one question I might get at the front end, because this may come up in as you open this up for public hearing as well, is there have been some questions over the last couple of days relative to the budgeted amount of $200,000 for potential property acquisition for parks. As stated in the budget document, and as we have discussed in our workshops over the last month, that is not at this time to purchase a specific piece of property. That is an allocation which would give authority, budget authority for a property purchase to be determined by council. There's been much discussion about the Baldy property, which is currently owned by our sewer fund. And as we have indicated in budget workshops and even at the initial budget presentation, we anticipate that property and the discussion of that property and future disposition of that property to come up in a council discussion later this fall.
Thank you for that. I appreciate it. Any questions from council? Okay. We will now move on to the public hearing. This hearing will be conducted in compliance with the following rules of procedure. Before testifying during the public hearing, you will need to complete a sign-up sheet available here at the front of the council chambers and hand it to staff there up front. We'll take comments from city residents first, and then we will hear from those who do not reside within our city limits. Testimony shall directly address the subject at hand and should not be personally derogatory toward any individual, organization, or business. Council may ask questions. If they do so, it will only be for the purpose of clarifying information. Once the public hearing is closed, there will be no further opportunity for public input. Please note that any written comments received prior to the meeting have been forwarded to City Council. The public hearing is now open to accept public testimony on the fiscal year 2021 budget and the city's intent to reserve the right to recover the foregone increase in a subsequent year. Comments will be limited to 3 minutes. Clerk, do we have anyone in attendance? Let's start there, please.
We have two signed up for public hearing. Both are on Zoom. The first one is Mr. Kluender, so we're going to try that again. Mr. Kluender? Okay. And then Jordan Emmert. Is not present, so no one else, Mr. Mayor.
And there's no one here that would like to testify on the budget or the foregone. Okay. The public hearing is now closed. In light of the information provided earlier, I would entertain a motion to table items 7C and 7D. Sorry?
Shannon, so moved.
Okay.
Two motions, one table, and then we'll
Yes, we have.
second that.
Okay, so yeah, I'm sorry, let me, I'm gonna have to pull that back. We're gonna first have a motion to approve, and which is not in here, but we're gonna do that first. So this, I would entertain a motion to approve the fiscal 2021 budget and intent to reserve the right to recover the foregone increase in the subsequent year. Is there a motion?
So moved.
Second.
It's been moved and seconded. Is there any discussion?
Yes.
Councilwoman Roll.
I am concerned about the $200,000 for land acquisition for parks, simply because I believe that we have a lot of other current parks that need care. The master plan was that we set out so diligently to do with some of our current parks didn't really include master planning for more acquisition. Also, I feel that we have been planning for different types of paved trails. The pathways in Lakeview Park need some work and replacing, and I believe that the $50,000 for all trails within city limits, including paved and not paved trails, will not get us very far in that direction. Also completing those Boyer connections that we have talked about for 4 years probably now. I feel like maybe some of those funds would be better used in the trails line item budget piece to make those paved connections that we've discussed for many years, as opposed to acquiring new properties at this time.
Question, so with regards to line items and flexibility of council at a future date to move money around from line item to line item, do we have the authority, does the council have the authority in the future to take a proposed purchase, $200,000, and reallocate that to other parks related expenses, parks of capital, other capital improvements?
Yes, Mr. Mayor, the budget, we could re-budget in terms of parks capital improvements. I would note that the $200,000 that is budgeted is parks capital impact fees, which are dollars specifically designated for acquisition of parks property and incremental capital improvements to parks based on staff analysis. The funds that are available in that impact fee fund, we believe and recommend that those dollars can be used for acquisition only at this point, given the value of the fund and the investment of impact fees into other parks capital improvements. So we have used a fair amount of our impact fees for improvements specifically related to War Memorial Field, which impacts the community across the city. But as identified in our parks plan and is presented by Green Clay, as we are seeing growth in the city, growth of population, particularly in the north area of the city, we have a lack of walking accessibility and availability of parks and open land if we want to keep the same amount of park acres per 1,000 population, and as well as that accessibility issue. And so again, impact fees, I'll remind the mayor and the council, impact fees come in from development. So new development is what spurs those impact fees to pay for capital needs that the development to pay their fair share. Based on development predominantly occurring in the north area of Sandpoint, we believe those dollars are really only can be used in the north area of Sandpoint, and that they are most appropriately used for property acquisition. We have other impact fees, which are specifically for trails and pathways. That is separate from the parks impact fee dollars.
Thank you for that clarification. Really appreciate that.
So to Councilwoman Rule's point, no, we can't use that for other things that she's asking. Is that correct?
You could potentially, we could look at, you could look at a rebudget if that is where council decided to go as we move into the year related to, again, capital recommendations through the parks plan. I would say trails and pathways, no, because we have a separate calculation and an impact fee that is specific to pathways and trails. This is specific to parks, capital improvements, and acquisition of parks property.
And to clarify, it was in what Jennifer said, but to remind council that at any point, the council can reopen the budget. It requires a public hearing and notice, and same process that we go through now. But the council always has that ability to amend the budget.
And in this case, it wouldn't require a public hearing because those dollars are already budgeted.
Right.
So.
Okay, thanks. Any other questions or comments from council? Woman Williamson.
Jennifer, just so I'm clear, and for the public as well, if we allocate those or approve those dollars this evening, we're going to revisit where those dollars would potentially be allocated sometime in the future. You've mentioned the fall to assess various different options for park acquisition. And if the council doesn't feel like it's appropriate at that time to acquire any property, we will be able to make that call. Is that correct?
That is correct, Councilwoman Williamson. So our plan is to come back to council with a presentation late fall, early winter, before the end of this calendar year relative to opportunities around parks acquisition. If council chose not to use those funds for any of the projects as presented, essentially those dollars would just fall out at the end of the year and they're available for rollover in the next fiscal year, or we could not budget them in the next fiscal year. But in addition to a plan for those dollars and laying out options for council, we do need to have a discussion about disposition of the Baldy property.
Okay, thanks. But we're not obligated, as I think I heard you say, we are not obligated to spend those.
That is correct.
Any other questions or comments, council? Okay. There's a motion and a second on the table. This will be a roll call vote.
Councilwoman Williamson,
Yes.
Councilman Darling,
Yes.
Councilman Grote,
Yes.
Councilman Sprow,
Yes.
Councilwoman Rule,
Yes.
Councilwoman McAllister.
Yes.
Motion passes. I would now entertain a motion to table items 7C and 7D, appropriations ordinance and approval of the of the 2021 budget and proposed resolution on the intent to reserve. I'm confused. So we had did we have that as an action item on the listed on the
Yes, we did for the proposed resolution. They need to do the proposed ordinance.
okay.
Yeah, but we're tabling that till next time.
The resolution and
Both
the
those two.
Okay,
Yes, both
yes.
So we're going to table 7C and 7D.
Yes, that is correct.
I would entertain a motion to table items 7C and 7D, appropriations ordinance and approval of the 2021 budget and the proposed resolution and the intent to reserve the right to recover foregone until council meeting, until next council regular meeting September 2nd, 2020. Is there a motion?
So moved.
Second.
It's been moved and seconded. Is there any discussion? This will be a roll call vote.
Councilwoman McAllister,
Yes.
Councilwoman Rule,
Yes.
Councilman Sprow,
Yes.
Councilman Grote,
Yes.
Councilman Darling,
Yes.
Councilwoman Williamson.
Motion passes. The first item under new business this evening is the treasurer's quarterly report for the quarter ending June 30th, 2020. City Finance Director Sarah Lynn will provide the presentation. Thanks, Sarah.
Good evening. I'll make this brief. Ending third quarter, we goes up through the end of June. As COVID came upon us early in the year, we were initially not knowing how that was going to affect our budget. So I will talk a little bit at the very end about that. It has not affected our revenues nearly to the extreme that we thought it was initially going to, which is good news. Starting with expenses on the general fund, things are looking very comparable to prior years. We are at 65% of personnel services. That's a little bit less than normal at this time, and the reason why is because we've changed from, again, as I noted last time, we changed from a 24 pay period to a 26 pay period in the year. And what that means is that the very last pay period in the year is actually falls in next fiscal year, but we'll be needing to accrue that back to this year because the days worked were actually in this year. So you'll see that actually a little lower than it is last compared to prior years. When you look at the charts here, go down to that chart. That one there, the very first one is wages and benefits trending a little bit less than it was in the prior years, but that will at the very end, you'll see that then even out at the very last quarter. M&O is looking very comparable to prior years as well. It is at 51% of budget. And then with our biggest quarter is usually the very last quarter, which we're in right now, and that's capital improvements that are done. That's going to be our downtown project, and any other major capital projects are normally done during this time of the year. So our biggest quarter is always the fourth quarter. The general fund, again, looking good compared to prior years. Revenues coming in, property taxes, we received the first chunk in January and the second one in July. So this is not reflected in as of June, at the end of June. You will see that obviously in the fourth quarter, but that is comparable. And again, going down the list, these are very comparable to prior years. Intergovernmental revenues, I wanted to point this out. This is going to be the amount that was allocated for SURA or budgeted for SURA dollars coming in for the downtown project. We have not billed them. We bill them annually at the very end of the project. So we are in the actual process right now to bill them. So that one looks very low compared to what it will be at the end of at the end of the year. Again, with the grants as well, we always budget a little, like $1 million extra just in case the grants come in. We are anticipating most of those actually come in next fiscal year for the launch and at that project as that project kicks off.
I would just note that we've received $1 million in grant awards this year, in excess of $1 million that we budgeted. We've actually received in awards, but again, it's the timing of when we actually undertake the projects because most of our grants are reimbursement basis.
I want to point out the state and local government shared revenues. We just got word that the liquor revenues, we just actually got an email the other day saying that they are actually 35% over anticipated budget for the year. So that last quarter distribution will be a lot larger than we anticipated on that. The sales tax is actually larger than they budgeted as well coming in. So we will not see a reduction in that. And the other ones are coming in very consistent to what we budgeted. So from a state sharing standpoint, there hasn't been any real drastic reductions in that. There's the revenue trending compared to prior years. Special revenue funds, fiber optic, that as we talked in the budget process, that did not occur in the current year, will be pushed over to next fiscal year. So the expenditures and revenues are on the low side of that fund. Capital projects fund, we are not doing anything we're going to be doing in that fund this year. Again, same thing, we are anticipating doing that next year. Recreation fund, that is looking comparable to prior years. The capital outlay for the rec fund, that was anticipation of the rec fund capital project or the capital plan being done. That has not been completed yet. So those dollars were set aside for projects slated. So obviously they're not going to be spent because we have not finished that yet. The local ops and sales tax fund, that is rolling in with the project at Memorial. We'll be seeing the most of that in the fourth quarter. Again, that will be spent towards the end of the quarter of this quarter will be spent out. Capital improvements and the park improvement fund, that one also was set aside for the parks plan being done, rolled over to next year for capital improvements. The water, sewer, and garbage funds are looking very consistent with prior years. The one I'd like to point out is a wastewater fund capital outlay. Those were budgeted in the capital for the bridge improvements. And we talked during the budget for fiscal year 21 that a lot of those were ended up being a lot less than what we anticipated for cost wise. So you'll see that of $111,000 of expenditures year to date to the 4.2 million and an appropriation that were budgeted. You will not going to see that very, very much because that was a lot less than what we anticipated initially. Revenues on those are also coming in consistent with prior years. More graphs to look at. Again, this is all out on the website. Local option tax, the 1% coming in, that was one of this and also the resort city tax. We were not sure how COVID was going to impact these. Local option tax, again, this quarter has outpaced last year's quarters, actually the whole entire year at this point. So that we have not seen a reduction. In fact, just the opposite. We've seen an increase again over last year in the 1%. We can pinpoint that down to a lot of it has to do with to our grocery stores. The resort city tax, that is one that we have seen a dip in. It is, if you look at this graph, the amount that we received this year to date is actually right on line with what we received in 2018. So we had a jump last year. We would anticipate another jump this year, just if things went the way they have gone back to about what 2018. The big quarters is really going to matter is this quarter now, is going to how that pans out. As you can see, our biggest amount is in the last quarter. There is what we received is July, August, and September. So we are right now receiving July's and in August for July's payment. So they are flowing in now. I'll keep you up to date on that one, how that one will come in. Other than that, not much else to report on.
Any questions from council?
I don't have a question, but I just want to say how thankful I am that we're in good hands. This is uncertain and unprecedented times, and for you to be this responsible and this professional with our money, couldn't have had better people in challenging times. Thank you very much.
Thank you, sir. All right, is there anyone in the public that would like to comment on this issue?
I would like to.
Okay.
I just wanted to say really quick that.
If you could state your name.
I'm Sandy and I'm from Dover.
Thank you, appreciate that.
I just wanted to say that the graphs that were just showed and the quarterly report tell a story of what we've just been through as a community and as business owners in the downtown area. And I appreciate you guys looking at the stories that those graphs tell you and responding accordingly and for paying attention to the quarterly report.
Thank you, appreciate that. All right. The final item. Yes?
Can I speak on that?
Yeah, please come to the podium and again, state your name for the record, whether you're not residing in the city, and if you keep it under 3 minutes.
Robert Edmondson. I'm not residing in the city, but have a business in the city. I just want to comment that I believe a lot of the reason that the economy is doing so well locally is because of the less restrictive nature of what we have going on in our town. I've heard it from many guests to our restaurant. I've heard it from many friends and individuals, and as well as my work at a local grocery store. Many people are visiting because they want a sense of normalcy. They do not like the restrictive measures being put on them in their states, and they've been very thankful to be well received in our community and well taken care of by our local restaurants and community, and enjoying the parks and recreation in our area. I think that's why our economy is still doing quite well. So, thank you.
Thank you for those comments. Yep.
Mr. Mayor?
Yeah.
Could you have just a brief pause so I can get the timer up?
Yeah.
Thank you.
It'll be like 30 seconds.
Okay, go ahead.
Brandon Dorman, I live in the county. I just wanted to echo what the gentleman before me just said. My daughter works for him. Been a very busy summer, as I'm sure you know, Joel. Lots of people come into Sandpoint because they can experience a normal summer here like they can't in other places. So let's keep it that way.
Thank you. Yeah, please come forward.
Hello, my name is Alex. I do not reside in Sandpoint, but I do a lot of business here because I live just outside of Sandpoint. I also want to reaffirm what the gentleman just said. Part of the reason I do so much business here is because not only is it nearby, but it's also, I do like the less restrictive measures that are here. And since Kootenai County now has certain restrictive measures that are not here, I have been doing a lot more business here in Sandpoint, and I know a lot of other people who.
Alex, I'd like to comment. This is a matter that's on the agenda. We've already taken, we're not taking public comments at this time about the masks.
I did not mention masks.
I think your comments are going in that direction, sir.
I was not getting any closer to it than what I said, and I did not
Well,
mention masks.
I would ask you to refrain from those comments.
All right, thank you.
Thank you, Alex. Please come forward.
My name's Mike Clark. I've worked here 25 years, lived in the county 35. I just want to say I'm one of the part-time volunteer chaplains at the hospital, 11 and a half years, been awesome. And I just wanted to equate that experience to what you all are doing. We'll go into rooms, we'll say, do we have your permission to, you know, say a prayer or just encourage you? And 9 out of 10, just not exact science, but we'll welcome that. And the result is, regardless of wherever we're coming from or how we feel about stuff, my experience is that God's peace will come. I mean, like, say somebody has an issue, we'll just get together, we'll just say, okay, hey, let's just turn this over. So I wanted to say the same thing for you all. I really appreciate what y'all doing, all of y'all, all you guys. My dad was from Louisiana, so that comes out now and then. But you know, I just want to say, you know,
Mr. Ford, can I ask you about this? I'm sorry. The mayor has requested comments on the quarterly report. I think that's what he was commenting.
Yeah.
He was asking.
This is not not that.
I think that's what you should limit your comments to.
Okay, well then I'll go, but I just wanted to welcome the same kind of peace to each and every one of you in this kind of time of conflict, you know, that we won't focus on just the division, but we'll welcome, you know, a little guidance and peace.
Thank you, Mr. Clark.
Thank you.
Appreciate that. Are there any comments regarding the treasurer's quarterly report? Okay, seeing none, the final item on the agenda this evening is a request from Councilwoman Rule for a mask mandate in the city of Sandpoint. Councilwoman Rule, do you wish to make a presentation?
Yes, I will make a very brief presentation. Can you hear me?
Yes.
Okay. I believe that it was Councilman Darling that had originally requested if there was a need for a mask mandate to come up, that it be placed on the agenda so that the public could be heard. And I heard that loud and clear, so that is one of the reasons I placed it on the agenda. And then I believe it was Councilwoman Williamson who requested a lot more data, which I respect her very much for. I believe that your request to have some of our public health district officials come up really took care of many of the things that I had prepared for my short presentation. But I would like to state that just reinforce that the Kootenai Health staff and physicians have dedicated thousands of hours to understanding and preparing for COVID and caring for the affected COVID-19 patients. And their recommendation to themselves and to all of us is to wear masks. And then I would go on further to say that as far as the metrics and some points to whether or not to wear a mask or not wear a mask, some of the eastern Idaho counties, which are very similar in makeup to our health district, the eastern Idaho Health District, They have 3 smaller counties and then 1 much larger county, which holds their hospitals, much like Bonner County and Kootenai County, use a metric of less than 10 active cases per 10,000 people over a period of 14 consecutive days. So that is something to think about. The other thing I would like to point out, that many of the people that approached me and encouraged me to move forward with the mask mandate are very concerned about our town. As our schools plan to reopen, they would like to set a very good example for our students and to have the follow through. They're also concerned as we all start to move inside, again, with our schools, as they have mask mandated, that potentially this will be what starts to shoot our numbers back up. So I wanted to point that out to everyone. I would also make a suggestion that if the power was given and the mayor decided to enforce a mask mandate within the city limits of Sandpoint, that we do attach some sort of incentive. I believe that in the state of Idaho, public health districts, Idaho Code Section 39401, a willful violation of public health laws or any other lawful order is deemed a misdemeanor and punishable by a fine not to exceed $300 or by imprisonment in county jail for a term not exceeding 6 months. So those are some other things for council to think about if to enforce this type of law. That is, I do understand it to be through a public health system, but I think it could give us good guidance. Whereas the state fines are $1,000 and a term of imprisonment not to exceed 1 year. I feel like as the public health representative encouraged all, that it is a matter of needing a significant amount of education, and I would press that we continue to educate, but when necessary, that fines could be, there would be misdemeanor, sure, punishable with fines and such. So I do not, I guess I would like to make a motion for the city council to adopt an ordinance creating Title IV, Chapter 9, Sandpoint City Code, granting the mayor temporary emergency powers to preserve the public health in response to the COVID-19 virus, specifically to issue an order requiring social distancing and masks or face coverings where social distancing cannot be maintained in the city of Sandpoint. And I do not, we'll have our discussion.
I have a question.
I'm sorry, Councilwoman Rule, did you?
I did not know if we will have our discussion before we make the full motion or if our discussion will happen after that. So however you wish to proceed, Mayor.
I'd like to hear if there's a second for the motion.
Well, first, Mr. Mayor, Andy, Jennifer, I've been confused the past 3 meetings or so. I thought we got rid of the rule that we have to second a motion to discuss it. And I just keep hearing like, we'll second a motion and then is there any discussion? I'm a little confused.
We'll have a discussion. We'll have a discussion.
Before a second.
I'm interested to hear if there's a second. If there's not a second now, we can.
Well, I guess the rules of law was we discuss it and then we second. Is that correct? Or am I wrong?
You need not have a second to entertain a motion or have a discussion.
Excellent. Thank you.
Okay. Does anyone want to respond to Councilwoman Rule's presentation?
Mr. Mayor. First, I'd just like to request that the other council members just speak into their mic a little bit more because I'm having a little bit of difficulty. I have my volume all the way up. From what I understand, there's a motion on the table. I understand there doesn't need to be a second to discuss. However, I am going to second Councilwoman Rule's motion because it needs to come up for a vote. I know when she, Councilwoman brought this to our attention the initial time. It was placed under the agenda in a format that didn't encourage robust public debate. And Councilman Darling spoke to that, and I agreed. And so it's coming before us again in a way that I feel like has definitely received very rigorous attention from the public. I think all of the council can agree to that. But I would like to see it discussed amongst the council, brought up for a vote. Otherwise, even if it fails tonight, it might come back before council. However, if it doesn't receive attention amongst the council in terms of discussion in front of the public, I can almost guarantee that it will. So if you would like to, solidify your opinion with a vote, I would encourage you to do so. So I am seconding the motion.
Thank you, Councilwoman. Anyone else? I'd like to go around the block here. I'm going to put you on the spot. Councilman Grove, any thoughts?
I have a lot of thoughts. I don't believe that people are interested necessarily in my thoughts. They're interested in a vote. I appreciate the presentation. What's on the table is to give mayor more power because we're in or move into an emergency situation. It sounds like our community is doing a great, if not good, or good, if not great job doing what it is that we're currently doing now, which is based off of the hearts and minds of volunteers. People are choosing to act in a way that is best for them. So I've been up here for 8 months. I've seen a few different categories of people, some that absolutely don't want to be told what to do at all, even if it's for their best good. Others that absolutely need to be told what to do. Others that will abide as best as they possibly can. And others that for one reason or another think that it is incumbent upon them to tell everybody else what to do. Those, I'm sure that there's other groups, but those are the four that I see. For something that if our goal is to value the health and safety of our working community, the best approach, in my opinion, is to try to get participation of all four of those groups as best as we possibly can. We can do that. We are doing that without providing you with more power, as well as not mandating. The heart of a volunteer is far greater than someone that is made to do something by force. So I recommend that we continue to have Panhandle Health District continue to give us more and more accurate current information, and we move forward incrementally because we have all been clearly educated that this is an ever-changing, it is ever-changing that requires us to be very flexible with the way that we watch over our people. Those are my thoughts.
Sure. Thank you. Councilman Esparro.
Yeah, I really appreciate what you said, Andy. I appreciate your heart, and we're a very capable community, those who choose to take care of themselves and to reflect off what Ms. McAllister, Councilwoman McAllister said last meeting with this particular topic was the importance of self-governance and just Andy and Ms. McAllister's trust in people in general, in our community in particular, of their responsibility to be able to take care of themselves. If you're willing to go out, you're taking a risk, in my opinion, whether you're wearing a mask or not, and that is your choice. If it's your choice to stay home and be taken care of because you are concerned, I respect that very much. And I've also said that I'd be one of the first ones to help you and bring you food and whatever that may be. I believe it's a very capable community, so I like to echo and Andy's comments as well as the past comments of Ms. McAllister's about self-governance. I think it's pretty clear in my opinion, so thank you.
Councilman Darling.
You know, a few weeks ago when it came up in our COVID update, it kind of caught me off guard because the COVID update was an action item. I appreciate Deb throwing it out there as a motion, but like I said, it caught me off guard, and I believe that this was the correct way to proceed with a topic such as great as this. And I appreciate you for going down the correct avenue for that. You know, I'm born and raised Sandpoint native, and you know, this place has been home to me my entire life and will continue to be. And I live here for a reason and for all the benefits of living in beautiful North Idaho. And if I wanted to live in a more metropolitan place, I'd have that option, but I choose here as home because of the way that we live, and I believe in those. I believe in citizens wearing masks and business owners requiring masks to protect their employees and their businesses. However, I just absolutely do not support any local government agency mandating masks.
Thank you.
Thank you, Councilman Sparrow, for recognizing me. I believe in self-governance. However, I also strongly believe in listening to what our constituents say. I myself, in the past several weeks, I bet I have spoken to over 300 people. I've been accosting people in my dentist's office. I've been talking to all the businesses because I run the Chamber of Commerce. And what the businesses have to say is very important to me. And really the situation comes down to, and quite honestly, even with the 800 and some emails that we had, it comes down to 50-50. I mean, Sandpoint City residents, I think it was 114 to 105, 114 for, and 105 no masks. And so really it's a situation that I think we need to listen to our constituents. And I think that they're, you know, it isn't a matter really of, I guess I personally think they shouldn't care what I think about it. The community at large they should care what the community, we were voted to be nonpartisan, non-political council people, and based on what our constituents want and what they need. And so I'm going to support it. Based on the input from the constituents, and people voted, you had every right. And also for those people, I just want to say, who we've been getting emails about, that we need to step up and be leaders. I would say the people that are writing that to us have no idea what a leader is. And so we do our work, we do our homework, whether we disagree up here, we're still friends afterwards, and we do our work and we talk to people. And so I don't want anybody here or who's listening to think that we don't. We listen to the experts. Catherine and I talk every once in a while. So I want you to know that we value your opinion. And it's really sad that it's become such a divisive thing in our community, because we've always gotten along, no matter what. And so now this happens, and it's interesting that, like, Councilwoman Rule is being bullied because she cares about your health. And we do have freedom. We do have freedom. We have the freedom to fall down and worship a gas pump if we want in America. I have a son who's in the Army. I have a child who's in law enforcement. So I respect that. But I also respect my constituents, and I respect what they have said. And I think the vote and people writing in, I commend everybody for doing that. And we have read, well, I have read every single one of them. So that's what I have to say.
Thank you for those impassioned comments. I do want to mention for the public out there, because this is really a significant public response that we got from all of you. Never before have we seen such a overwhelming response from the public on any issue here ever. We had 883 emails on this issue this week. This amounts to over 44 hours of public testimony, which is why we only allowed written comments prior to the meeting, because we would be here until Friday listening to this, so if not Saturday. And at this time, actually, I would invite the clerk to provide a summary of those responses.
Thank you, Mr. Mayor. just real quick, so 883 total comments on this issue. The total in favor of a mask mandate was 415. The total of those folks who were not in favor was 470. Of city residents, 102 were in favor, 81 were not. Of those who indicated they did not live in city limits, 72 were in favor and 97 were not. And most of our messages came from folks whose residents we did not know or could not confirm. 241 were in favor and 292 were not in favor.
Thank you for that, I appreciate that. And let me be clear that this is not a public vote, right? But these numbers, these responses, this data point is helpful for the council in understanding where the public is at. And it's helpful to the council in making a determination on this council vote. So I just want to be clear about that. There was a comment from Councilwoman Williamson, please.
Yes, thank you, Mr. Mayor. I appreciate all the council's thoughts. I wanted to reiterate that this has become just really an impassioned debate on both sides. And I've heard, arguments just as strongly on one side as I have from the other. And personally, I'm not keeping score. And none of us, even if we're not there in front of you today, but sitting up at the dais there, it's going to change anybody's mind. Everyone's a scientist now, and you're going to believe the science that supports your confirmation bias, whether it's right or wrong. And anybody around you that you disagree with can talk blue in the face, and it's not going to change anybody's mind. And that's what I've learned from reading emails, talking to my constituents, talking to those that are not technically my constituents, but work and spend dollars in Sandpoint. And so for me, that's told me a lot. And I'm sure you probably had your own conversations where you learned the same thing. And I really appreciated the presentation from the Panhandle Health District. It's my very firm belief that the 6 of us are not qualified to make any kind of decision on public health. I know we're being asked to give the mayor those powers, and I don't think he's qualified to make those decisions either. And so the public health district that has medical doctors on their board and made the call in Kootenai County will make the call if they need to here. And that's my opinion on it. Thanks.
Thank you for that. And I would ask both Councilwoman Williamson and Councilwoman Rule, if you can speak into your mic a little bit. It's difficult for us to hear you here. So please, thank you.
Sorry
Councilwoman
about
Rule.
that. I can clarify if you need me to.
Go ahead. Councilwoman Rule, go ahead.
Moving my computer closer. Is that better, Mr. Mayor?
That's good, thanks.
Okay. I just wanted to thank Councilwoman McAllister for mentioning that I have been bullied. And I would like to just let her know that I'm okay. I brought this forward because I was asked by the constituency. I agree with her in that I don't think anybody wants to hear about my personal opinions. I came forward with this because people wanted me to come forward and they wanted to be heard. And they felt like it was something that this city needed to show leadership on. So at some point when you sit up on the dais, you have to decide how important that issue is. And I would just like to say, with almost 900 comments, I think that it was well worth the time and all the effort to bring this forward to the council. And that is all I have to say. Thank you very much.
Thank you, Councilwoman. Yeah, go ahead.
So if these powers are granted to the mayor, Andy, maybe you could speak to this. That's 5 miles. He also has authority 5 miles outside of the city limits. Is that correct?
I think that the ordinance that's been proposed confines itself to the city.
The city limits only.
Mr.
So,
Councilwoman Williamson.
Councilwoman Williamson?
Yeah, just point of clarification. I believe Deb had proposed some enforcement recommendations, but I would just like to hear from staff if they've looked into those enforcement recommendations or what they would plan to do in terms of enforcing an ordinance if passed.
Corey, do you want to speak to that? Andy, feel free to jump in if you have something to say there.
Thank you, Mayor, Council. So the question comes down to is the enforcement action of this if it passes. So it goes back to that same conversation that we had a couple of weeks ago. There's an educational, if the council and the mayor agrees to it, there's an educational piece that needs to take place first before any enforcement comes into place. This is one of those challenges that any new law has or any new ordinance would have, is that enforcement. But in short, it's education first, enforcement second, and then be able to get buy-in from everybody. I've read over the ordinance. There would be some clarifications before the mayor signed it in that I'd like to visit with about the legal, just some of the terms and some of the expectations, but I think those are minor at that.
Does that help, or do you have a follow-up, Shannon?
That's good, thank you.
Okay, thank you, Corey. Stay close. Any other comments? I too had that question for the council and whether they feel, I mean, obviously if the city were to adopt such a mandate, enforcement would be, education would be key, and that would be first and foremost. But obviously enforcement would not be something that is going to be realistic. While individuals could be made an example of, so to speak, if they were, blatantly disruptive or whatever. But the reality is we could look at Kootenai County, for example. They've had a mandate in place for a few weeks now, I just spoke with the city administrator of Coeur d'Alene yesterday, and he was relaying to me his experience and their experience in terms of enforcement. Their number one protocol has been education. That's been their approach. They have not made a single arrest. And if you look around, you walk the streets of Coeur d'Alene, you obviously see a lot of people who are not, wearing a mask in public gathered settings. But there has also been an increase in mask wearing in his experience. So I think, that's what we would expect, something like that here. Obviously, you're not going to have full compliance. You're going to have people that are not going to want to do that. And then, the city leadership, law enforcement has to make a choice. Are we to, make an example of people who do not want to follow a mandate? And, under what circumstances, what conditions, all those kinds of difficult questions. And then, what is the penalty for such an infraction? So, I think that those are the really hard questions. And I would invite the council to weigh in on this. From my perspective, it's unrealistic to think that the city is going to offer any, real enforcement on this issue. But what this mandate would do is it would set it would make a statement of where our priorities are at as a community, where our values are at, and that we, in my opinion, that we're concerned more about the short-term public health and welfare of our community, particularly those more vulnerable. Because as was shared by Dawn of the Panhandle Health Department today, while wearing a mask can potentially have a safety effect for you to wear, it's really about protecting other people. And I've got a cold right now, and I'm wearing my mask every day to protect people around me because I don't want to get them sick. I'm not worried about getting sick. I'm worried about getting somebody else sick. And if that person across from me is, has an underlying health condition, is at risk, I'm putting them at greater risk. And so while I have every right to express my freedom by not wearing a mask, it's irresponsible of me to put somebody else in harm's way because, you know, I don't feel like wearing a mask. And that's how I feel. I feel like it should be our responsibility as citizens to protect our fellow citizens. And I certainly feel that way, you know, about regards to my own behavior. So, so I think, you know, with a decision like this, you know, I think it really comes down to the council has to consider if they're going to vote for this. They have to consider if that's going to be followed through with some kind of enforcement and what that looks like. And again, I just want to reiterate that I think it's important to think about why we're doing this. And we're all up here thinking about this and discussing this because we're concerned about public health and safety, not because we want to issue any mandates or make any more laws or, you know, intrude on anyone's personal freedoms. We want less people to die and less people to get sick in our community. And particularly, it's particularly important to send that message, I think, when we are a tourist destination. And we were a tourist destination before COVID, and we're a tourist destination, especially during COVID. And you know, the gentleman's comments earlier were right, that if people do come here, because they can come here and not wear masks. And it's great for business. It also increases our public health risk because we're inviting that. And when we invite people here without masks, we take on that risk. And so that's something to be weighed here. And I think that if we were to go forward, you know, if the council were to vote today in favor of a mandate, it would send that message to the world at large out there that, hey, look, we're taking this seriously as well. And just because, you know, and we expect visitors here to respect the public health and safety of our community as well. So whether or not that would, you know, whether or not any enforcement would be part of that protocol, that's part of what has to be decided here by council today. I think if there actually is a vote to grant these executive powers.
Mr. Mayor?
Yeah.
To be clear, we're not voting for a mandate. You will be the one issuing the mandate, correct?
Yeah, so, and Andy, let's get clarity on this. So what we're actually considering here this evening is this, council doesn't have the authority to issue a mandate like this, a mask mandate. That can only come from the mayor if it's not going to come from the governor or the Panhandle Health Department. But that can only come from the mayor if those emergency powers are granted by the council. So what's being discussed here right now is whether or not council wants to grant the mayor those emergency powers. Those are in effect for 7 days. If, and within that 7 days, the mayor would still have the choice of whether or not to actually issue a mandate. You know, mayor wouldn't be required to issue any mandate. So at the end of that 7 days, then it would either, you know, expire, or the council could convene again and extend that executive order, or that those emergency powers, and thereby extend the mandate.
That's
Okay,
correct, Mayor.
Okay, so is that clear? Okay, so any further? Yeah, Councilman.
I just wanted to make a statement and point out that we have many laws and ordinances within our town, things such as not texting or speaking on your cell phone in your car. We have speed limits. We have seatbelt laws that, and all of those things, not everybody gets caught, but they are enforced, and they are enforced with fines. But I would also say that probably on the front of that, it is usually enforced with education. I'm sure everybody in the room has been pulled over once in their lifetime if they're around our age, and they've been told to slow down and not gotten a ticket. And then they've been pulled over another time where they've been given the ticket. So just as any other law, I don't think we need to make this any different. We are not going to approach every single person, but I do think that in certain and in most circumstances that you do need to apply the laws that are out there. Thank you.
Thank you, Councilwoman. And I will remind the council, you know, we have had this conversation before, not with regard to mask mandates, but we certainly, not this council, correction, but the previous council, many of you were there. We determined as a body that we were not interested in pursuing laws that we can enforce, and that moving forward, we wanted to ensure to have consistent enforcement with all of our rules, policies, regulations, etc. So I do think it's important that the council, if they're in favor of this, extending, well, if they're in favor of the mask mandate, that we do include in this conversation what enforcement could, would, and should look like.
Question.
Councilman Spiro.
Yep. Sir, I'm so sorry, I forgot your name. Don Duffy. Yeah, would you mind coming up a little bit, please? So, Mr. Don, is that right?
Yes, sir.
Do you believe that you know more about COVID, the COVID virus and the pandemic than any of us up here or on the screen?
Well, that's a tough question. I certainly have more experience with it, probably.
Yeah. And those who issued the mandate, would you say that they have more experience and understanding of the virus than anybody here on the screen? The ones who issued for Kootenai County?
Yeah, that would be the Board of Health, and yes, I believe that.
Okay. That they would know more than we do?
Yes, sir.
Right. So just to remind me, so I fully understand or try to understand why they didn't issue a mandate for Bonner County.
It was a number of reasons, and one I failed to mention earlier is number one, the case count was nearly double that of Bonner County. I'm talking about cases per 100,000, so we level the playing field, right? We were beginning to see a significant increase in hospital admissions. That was another reason. And certainly it was just overall wanting to prevent the disease. But another factor is we were beginning to see an increase in cases in long-term care facilities. And the statistic I failed to mention earlier was there's been a total in Panhandle Health District of 181 either staff or residents within long-term care facilities that are COVID positive. And only 3 of those are found in Bonner County.
So the reason they didn't issue a mask mandate here, are you allowed to speak to reasons why?
Yeah, just I think has a lot to do with those statistics that I just mentioned. We weren't at all seeing the case count here like we were seeing in Kootenai County.
I really appreciate you coming up.
You bet. Thank you.
I have a question.
Yes.
Can you please tell me the names of all of our Panhandle Health Board advisors, I guess, the people who sit, and what their educational background is, or what their degrees on, or their professions?
So you're speaking of the Board of Health?
Yes, the Board of Health, the members that sit on the Panhandle Health District Board of Health. If you could please tell me what their background in education is in and their names.
I don't know all of them in terms of their background in education. There's Marlo Thompson, who's the chair of our committee, and he represents Benewah County. In Kootenai County, we have Jan's her first name, I forget her last name. Jay Nelson, thank you, Christina. Jay Nelson is an RN. She's a BSN, actually spent a lot of time working at the hospital, so she certainly has medical background. We then have Mike Fitzgerald, who is a county commissioner in Shoshone County, and he is an engineer by trade. And we also then have here in Bonner County, we actually have Glenn Bailey, and Glenn Bailey's experience is in the military. I don't know other businesses that he may have been involved in. We also have Dr. Banks, who has a PhD in a science field. I don't know which one that is offhand. And then we have Walt Kirby, who is on our board, who represents Boundary County. And I know Walt's been involved in the trucking industry. And that's the best I can give you for your question. I wish I had more information, I'm sorry.
Thank you. Appreciate that.
Thank you very much. So I would just put out there to you may sit if you'd like. I have no other questions. I'd like to point out to my fellow council members that our Panhandle Health District Board, who actually votes, does not have medical background other than one RN that could be named. She's not an epidemiologist, but I do believe her vote was for the mask mandate. So the other individuals you're relying on upon this board do not have medical backgrounds. And I believe Mr. Banks has a chemistry degree, and he is a PhD, but that as far as medical field, they do hopefully listen to all the data and the information that is given to them. But I think that you need to realize the educational backgrounds of these individuals.
And Councilman, I'm so sorry, I did forget one member is our doctor. It is required that we have an MD on our Board of Health. And Dr. Richard McClandress also sits on our board. Thank you.
Do we know what his area of specialty is?
Dr. McClandress' specialty is in family practice. He also oversees the University of Washington residency program here in North Idaho as well.
Thank you very much.
Thank you, Councilwoman. Appreciate that. Good point. Anyone else? Okay. I do find, so this issue came up, what was it, a month ago? And I can appreciate the councilman's concern that it wasn't appropriately agendized to invite the proper amount of public input. Certainly not what we got this evening. But I do find it, noteworthy that at that time we had, it was around that time, I think shortly thereafter, that we had the peak of 72 active cases here in Bonner County, as I recall. And now, according to the report from Mr. Dubby this evening, we're down to 29 active cases currently. And, we've also, and I wasn't aware that a lot of our inpatients were being treated in kidney health. So that kind of changes things in my mind a little bit in terms of our impact on Kootenai Health Center down there. So, but I also, am aligned with your comments, Councilman, that I'm encouraged that here we are at the tail end of the tourist season, and rather than continuing, and we haven't had a mask mandate, we have been relatively relaxed here in Bonner County compared to other communities. But again, given our rural nature and the effective actions of many citizens who've taken it upon themselves to wear masks, to social distance, and to take necessary measures to reduce the spread, we are seeing now a decrease in cases over the last few weeks. So that's really encouraging, and I think going in, into the fall, as we see less tourist influx here, hopefully we can see that continue. But we also know that flu season is around the corner, school season is around the corner, and that's going to be a game changer for everybody. All of these are just observations that I think make this decision, I think, more difficult.
Mr. Mayor.
Yeah.
I would just like to challenge you on your words a little with relaxed. And maybe you didn't intend this, but I don't think that anybody's been relaxed for this year at all. I think that we've been diligent. I think that we've been concerned. We've been conscientious. We've done everything that we possibly can. What we've had difficulty doing is being relaxed. So with that being said, I want all of us to be considerate about the secondary and tertiary effects of what a potential mandate will do. If our goal, if our objective is to get compliance, for whatever word and mask use, telling people what to do might not be the best pathway to get masks to be used.
So, Mr. Mayor, what I hear from you is you're saying you wanted to hear from council, and what I've heard is 3-3 split, possibly 4-2 split, and I guess what are your thoughts?
Yeah, well, thanks for asking. Yeah, I think this is a tough decision, and certainly, you know, as an elected official, it's my duty, it's all of our duty to represent everybody as best we can. And, you know, here we see, I don't know if we've ever seen our community so thoroughly and passionately divided on any issue before ever. Because this is one that affects every single one of us. Not just, you know, this isn't, you know, we're all potentially impacted by this. And if we're all wearing masks, we actually all are influenced by, impacted by this. So whether, you know, we're, you know, concerned about COVID personally or not, it's, you know, it impacts us and it's on our minds. So I think this is a really difficult issue. I think what's clear to me is that, you know, I hear the recommendation from the CDC was reiterated from Mr. Duffy here this evening. You know, we can self-isolate, we can hand wash, we can social distance, we can educate. If we can't social distance, and if we're going to be in personal contact with within 6 feet of another person for greater than 10 to 15 minutes, that wearing a mask is advisable. And those are what we can do as a community to protect ourselves and particularly to protect those more vulnerable in our community. And so I think, you know, it's our duty again to, again, I keep coming back to protect those most vulnerable amongst us. You know, we all have, I hear a lot of people say that this is an issue about personal freedom. And yet, and I simply don't see it that way. You know, nobody's here complaining about, you know, having to wear a shirt when they go into City Hall or go to a restaurant and wear shoes, right? But, you know, the old no shirt, no shoes, no service. Nobody's complaining about that. We all just sort of comply, right? And, you know, in my mind, a mask is not a lot to ask when we're potentially saving somebody's life. So I think I think what we can do is not just set the example. We've been trying to do that for several months. I think we as a city have been proactive in trying to educate. We've provided masks for the public. We've had redistribution of masks that were provided through, you know, we were able to purchase the masks through the CARES Act. They were very well received. I think we've really done well to do that. I think that going forward, I think it is important to set an example. I think it is important to say that that public health is a priority for us as a community, and particularly as we're heading into the fall, into school. You know, we need to set that example for the kids as well, which is where, you know, as you all know, schools are incubators, and I think we all anticipate that when school starts, we're going to see a different situation here in terms of COVID outbreak here, like we will across the country, across the world for that matter. But you know, we're not there yet either. You know, here it is, you know, August 19th. So you know,
this has been a really difficult issue for me. I think, in my mind, if there's a way for us to chart a middle path, it's to state our value and our respect for public health by issuing a mandate. And, in terms of when we look at an enforcement protocol, that it be focused entirely on education. And, if there's, regardless of this vote here this evening, if this was voted down, I would still say to the public that, right now today, if you're a business owner or if you work in an institution here in Sandpoint, and your business or your institution has a mask mandate internally, and you require employees and customers to wear a mask when they come into your establishment, and you have people coming in without a mask, not respecting your rules, and and won't leave, you have every right to call 911 and trespass them, and that is your right as a business owner, as a private property owner, to make the rules of your private property. And if you want to kick somebody out, we will support and enforce, the laws that are on the books, and one of those is trespassing. So,
Mr. Mayor, if you have a cold, why are you not self-isolating? Why are you here?
You need to go.
You belie what he says. Nazi.
So, trying to answer your question, I think if there's a middle path, it's, I don't think that we want to make ourselves a COVID tourist site. I think in the long run, I think in the short term, that may be good for business, and I think in the long run, we subject ourselves to greater risk. And then, of course, we're not doing anything, without a mandate. I mean, who's standing up for? We all have a right to wear a mask or not wear a mask right now today. But if I have a health condition and I have to go to supermarket or to work, and there's people there, or I have to take the bus to work, wherever the case may be, do I have a right to go to work or to go to the grocery store and not be potentially impacted by others who are maybe inadvertently, carrying the virus, and they're incubated, so they're not symptomatic, and then I could be put in harm's way, and I think that person who has that underlying health condition or whatever it may be, they have a right to be in a safe public place as well, and they have a right to go to the grocery store, get on a bus, and not be impacted by somebody else who sees that it's more important to not be concerned about maybe isn't concerned about their health, but they're not considering their neighbor, is what I'm saying. And I think it's important that this isn't about us. This isn't about me. This is about the people that I impact. And it isn't about any individual. It's about the people that individual may impact. So I think that's the perspective here that gets lost in this discussion. Is this all becomes, a lot of the conversation that I'm hearing out there in the public is it's about personal freedoms, and it's not about personal freedoms. It's about the impact on others, the inadvertent impact on others. And I think that is an important part of the discussion.
Correct. So I completely disagree with that disruption. I completely disagree with the out of order context. We have rules of engagement. This is a sacred space. We are supposed to honor and respect one another. The point that he had made with one of the recommendations of self-care is to self-isolate when one is sick. Did you admit that you were sick and that you have a cold?
Yeah, I got a COVID test on Thursday, and it was negative.
So I want to just make sure that we are aware of our own personal hypocrisies, and that we do not, if we are the example and these are the rules, we have to follow the rules. Understanding that I completely disagree with the way that that was handled, but the statement gentleman made on his way out is accurate. So regardless of how we decide to go, so I will qualify that. Absolutely not, Mr. Mayor, Mr. Mayor. I love you, buddy. You are absolutely not. I do not agree with that at all, okay? However, if we are going to follow the rules and self-isolating when we are sick and we are supposed to stay home, my ask of you is that you attend our meetings remotely, following the rules.
Okay, and on that note though, Jennifer, are we not considered city employees? Are we? I mean, we're elected officials, but
For purposes of compensation, payroll compensation, and benefits, we treat the electeds like employees, but in terms of your legal standing, our electeds aren't employees of the city.
okay, to give another example, city employees are required to wear masks. Are required to wear masks. And we see them all wearing masks, but you don't wear masks. So I'm just trying to give you the tit for tat, right?
It's not requiring masks.
Right, well, the city is, the employees.
I'm not
I think that there's some gray area if we're
Right, but
employees or
I'm
not.
saying, right,
Employees can be
that's why I
fired.
asked her. That's why I
Yeah,
asked her.
yeah, Andy said no, so I was just double checking.
You're elected officials.
Okay, what we're discussing here this evening is a motion to grant the mayor emergency powers for issuance of a mask mandate. So I want to bring us back on topic here. This isn't about me. This isn't about you guys not wearing masks. This is about the issue at hand. So, councilors, any last comments?
So do we talk about enforcement before we vote, or how does that
I
work?
would love to hear your thoughts on that.
Is that correct, Andy?
The ordinance that's before the council, the draft ordinance, does not have an enforcement mechanism. If the council wants to decide to add an enforcement mechanism, you could do so, or you can vote on the ordinance as presented. It's your prerogative.
Then, Mr. Mayor?
Yes.
Mr. Mayor? I would move to add the fines and enforcement to what is in front of you.
I'm sorry, can you say that again?
As I spoke to earlier, I would move to have the misdemeanor and fine enforcement as the Panhandle Health, or not as Panhandle, but as the health districts in the state of Idaho use, a $300 fine and up to 6 months. And Andy has the number to refer to that. I don't any longer have that in front of me right at the moment.
That statute is only applicable to public health districts.
Okay.
I understand that, but I think it is good guidance in that at Sandpoint, many people decided that that was an appropriate fine. And I don't feel that we need to recreate the wheel. We just need to make that wheel work for us.
I'd like to know who created the wheel to justify those fines or jail. That'd be important as well. If you want to speak to why the health district came up with those numbers, I'd love to hear that, please. If you can, I understand. I don't want you to say.
Yeah, I don't have a good answer. I know there was some precedence with District 4, meaning the Ada County area when they came up, but how they derived that, I do not know.
Yeah, like 6 months in jail. Yeah, I guess, what is the level of this crime for not wearing a mask? So we can talk about that. I've heard somebody say that not wearing a mask is equal to murder. I heard up here, Mr. Mayor, I heard say like save lives. So those are pretty heavy words to me, you know, murder, save lives. Logically, the conclusion would be not wearing a mask equals not saving lives. So my question would be, is not wearing a mask equal to murder? Is it equal to not saving lives? If so, maybe the punishment should be harsher, right? Manslaughter? I don't know. Why 6 months in jail and $300 fines? I'm just trying to understand the numbers to justify it. Talking out loud to fellow council members.
Councilwoman Rule, was that a motion to amend?
I'm sorry, I did not hear you.
I just want to clarify, was your addition there, was that a motion to amend, adding an enforcement of misdemeanor that reflects the health department's misdemeanor regarding a health infraction? Whatever.
Yes, it was. Yes, it was. But I would point out that I would encourage strong education and that these fines of misdemeanor would be used at officers' discretion. But I think that if we move in this direction, you, just as you have a seatbelt law and a speeding ticket or anything else, if you're not following the laws, then you get fined.
I think that's excessive though. I do need the $300 in the 6 months. I just feel it's excessive.
I agree.
Yeah, I mean, yes, the education, our officers do a great job of that. They did that during quarantine, but I just think that's excessive. Because there are some people in our community that would not be possible.
Well, and I want to be clear here too, and actually this did not come up before. And in Mr. Duffy's presentation, he did mention the CDC's guidelines that exempt for other cities, other states that have mask mandates. They have exemptions for people with health conditions such as asthma, children under 2. There's a list of exceptions under the CDC website, and I want to be clear that it's my expectation that when we're even discussing this, that it would only be discussed, including those exemptions for those with health conditions and otherwise. So I'm assuming the council's all on the same page there.
Mr. Mayor.
Yeah.
It might be helpful to have Chief Kuhn address some of the challenges from a law enforcement perspective and enforcing mask ordinance beyond education. I know he's done a lot of research around what other communities are doing, and particularly with the specific exemptions that are provided in the CDC guidance relative to being in proximity to a family member, or if you have some type of an underlying disability that may or may not be visual, and some of the other challenges. Those create the challenges for law enforcement in terms of enforcing the mask mandate beyond education, and also create liability issues for entities relative to that enforcement.
Yeah. Great.
I'd like to speak to that in that I think that law enforcement always has to use their judgment when implementing fines or dealing with people who are not abiding by laws.
Thank you. Just to clarify a couple of things. So we're talking about misdemeanor, which is that legislatively with that fine of $300, 6 months in jail, which the state has adopted for that code. To kind of go back just a little bit before I talk about Jennifer, there's 2 other pieces of this puzzle on an enforcement plan that we haven't even discussed. So we passed an ordinance The police officer goes out and writes a citation. That citation then goes to the prosecutor's office. He has to then file it with the court system. He still has that discretion not to take it anywhere. Then it goes into our court system. With the judges right now already overwhelmed. I haven't reached out to the judges to find out their thoughts on it. I've reached out to the county prosecutor, Lewis Marshall, got some of his thoughts. I'm not sure if he submitted anything or not, so I'll let him speak to that at a later time. I can tell you if we were to actively enforce, and I think we talk about an educational piece, we talk about to that point of starting to issue citations, at what point do we draw that line? There's the other side of it that you have to ask yourself too, is the prosecutor's office, are they going to file those charges? If they file them, what are the judges? So there's more to a $300 fine. So that's why some of those pieces that we could talk about later. One of the other things I've talked with chiefs, not only in Idaho that have some of those mandates currently, some in the state of Montana and some in Washington, and some of the challenges they're having just enforcing some of those ordinances is pretty challenging. Our city administrator brought up some of those issues, family members, groups of people, with and without a 6 people, people inside of rep businesses, some of those where they classify that as their personal space. Do we have the authority to go into a business and enforce mask mandates as defined, what we define as public space? Is that public space? Is it not public space? Do we have the right to contact somebody and ask them if they have a card or a medical waiver or some of those? So there's some legitimate concerns legally that comes into when we stop and talk with somebody reference to crimes. I think that from our side, we have to highly educate our officers on what we can and can't do. So the fallback plan, as you've heard every chief and sheriff across any area that's done it, is that we're going to emphasize the educational piece, because the educational piece is something that we know that we can do fairly effective. The enforcement side of it is complicated for several reasons, which have been kind of listed today. So hopefully that kind of summed up some of those. Any questions?
Okay.
I think you're looking for a second, Mr. Mayor.
Is there a second on the motion to amend? Yeah, so I'll do my best here, but the motion to amend would add an enforcement of a misdemeanor that reflects a $300 fine and right? And then with an education component as well, that we expected as it would be required as part of this ordinance anyway. So, Councilman Rule, do you want to? Is that adequate? Do you want to add anything to that? Did I capture your amendment there?
Yes, it was a $300 fine and or the imprisonment piece. I think that in this case, if council is feeling uncomfortable, the fine may be sufficient. But as we give you the emergency powers, you would have final discretion on how to set that up.
So your motion to amend then is to add enforcement penalty of a misdemeanor of a $300 fine.
Correct.
Okay. Is there a second? The motion to amend fails. Okay, so
Do a roll call vote.
here we are back at the main motion. I think we're ready for a vote. Everybody ready?
I'm not. Let me just want to be clear for our constituents, for ourselves, what I've heard tonight, summarizing it. I just want to say this is what I've heard, and I'd love to hear real quick what you've heard. So I've heard we need to listen to our constituents, those who voted us in, right? What I heard from Ms. Ward over here is that it's pretty much about a 50-50. Now, again, I don't believe that's the way we're elected to do, is vote by percentage. If that's the case, then we need to not really have meetings, but just have polls on Facebook, make sure the city residents have a poll where we don't even have to talk about it, where we can just go by percentage. But I don't believe that's how government works personally. So I've heard about a 50-50. I've heard we need to listen to them. So it's about 50-50. I heard that the Panhandle Health District Board possibly is not adequate enough, is not smarter than we are about this virus. Yet they voted Kootenai County have a mandate. They didn't vote for Sandpoint or Bonner County to have a mandate. So maybe they are smart enough when it's convenient, and they are smart enough when it's not convenient. I don't know. So I've heard pretty much just 50-50, and almost this feels like going this direction isn't really going with what the constituents want, but really comes down to 50-50-ish votes. But it really comes down to what we as a council, if we want to give the mayor that responsibility and pressure, I would add a very big pressure to go along with, if he chooses to implement a mask mandate with possible penalties or not for 7 days. So that's kind of what I've heard. I apologize if that's not clear. And I want to be clear, Mr. Duffy, I was no way intended to put you on the spot in a negative way whatsoever. So just want to be clear. Thank you.
Anyone else? Going once? Going twice? Oh. All right, Councilwoman Williamson.
Thank you. Can you hear me okay?
Yeah.
Okay, great. I appreciate all the conversation tonight amongst council and staff. It's been really helpful. You know, I just want to encourage everybody, like me personally, I wear a mask. I have my family wear a mask. I encourage everybody I know to wear a mask. But I've also heard and spoken to many people that I can talk to for the next 365 days about the science that you may or may not believe in. And I can talk till I'm blue in the face and you probably won't wear a mask. And so for us to say you have to, against what may be a very deeply ingrained belief system, I can understand is very troublesome. That being said, I encourage everybody to wear a mask, protect yourself, protect others. And for our businesses, if that's what you decide, if that's what you want your customers to abide by, if you are a customer, please respect them and wear a mask if you want to patronize them and they need your support. It's just be kind. Don't bully anybody for either wearing a mask or not wearing a mask. Is it up to us to give somebody else the authority to mandate masks? I'm not there. And I do appreciate the data that is collected every single day by Panhandle Health District. And they did vote 3-2 in Kootenai County to institute a mask mandate when they felt that they needed to. So whether we ever get there in Bonner County, I don't know. But I don't feel like that is the council's responsibility to give the mayor emergency powers when on this particular date, when we have 0 hospitalizations, 0 usage of our hospital for COVID at all. So just my takeaway is just be kind to each other. Respect people. Do what you need to do to protect yourself. Thanks.
Well said, Councilwoman. Appreciate those comments. And I would agree with you in that, you know, I think that the direction that we're headed in right now, we're seeing a decline in cases. And as I said, you know, we're nearing the end of the tourist season, I think. We're headed in the right direction, and people are engaged on this issue. They're doing what they can to protect themselves and protect their fellow citizens. I think for the most part, you know, we're doing really well as a community. So that's great.
Anyone else? Okay, this will be a roll call vote.
Councilman Grote,
No.
Councilman Espero,
No.
Councilman Darling,
No.
Councilwoman McAllister,
Yes.
Councilwoman Rule,
Yes.
Councilwoman Williamson,
No.
Motion fails.
And with that, thank you, everybody. That was a really great discussion. I appreciate everybody's thoughts and words on that. So thank you to the public who participated in that as well. In particular, thank you to the Panhandle Health Department. Really appreciate you guys coming out and giving us your knowledge. So
Thanks for sticking around for the long haul as well. It's a long one.
So with that, the public meeting, the council meeting is adjourned. Thank you.